Okay, so now we're moving on to category 3. The first thing we would do would be a prone leg length analysis, which we've already done in previous videos. Once we've done that, we can move on to the glute fiber analysis. As you can see, my patient is prone, and what I'm going to do is I'm going to palpate, go to the iliac crest, go down to the PSISs, which correlate with the L5 lumbar vertebra, and then we're going to palpate out laterally along the crest, 1 human inch, L4, L3, L2, and L1. And then so we're going to do this on both sides, and we're going to find the most tender points and then compare those points, and whichever one's the most tender correlates to the specific lumbar vertebra, and this is relating to the Lovett Brothers system, and then later on we would adjust this vertebra. Okay, so now I'm going to be performing the Soto or step out toe out technique. As you can see, my patient is prone on the table, and the indicator for this is sciatica. So what I'm going to do is I'm going to come to the affected side leg. I'm going to grab it right about here at the ankle, and then distal thigh area above the patella. I'm going to bring the leg out about 14 inches or until the gluteals bunch. Then I'm going to externally rotate the foot. I'm going to hold this for 10 to 15 seconds. Okay, and then I'm going to bring the leg back, wait a few minutes, and then I'm going to do the same thing again. Bring the leg out, externally rotate the foot, 10 to 15 seconds. And then I'm going to, after that, I'm going to see how my patient is feeling. If they said the pain got better, that would be an indicator for sciatica. If the pain got worse, that would be an indication for a sequestered or herniated, or a sequestered disc. And if it stayed the same, then it would be a subluxated or herniated disc. And this technique is both therapeutic and diagnostic. Okay, so now we're going to move on to the Cat 3 blocking, and the goal of this procedure is to reduce pain. So what I'm going to have you do is I'm going to have you go prone on the table for me, please. I'm going to make sure that the board is 4 inches above his iliac crest, and I'm going to use this as my sternum roll. Can you lean up for me? Okay, perfect. Okay, so on this occasion, what we're going to do is we're going to say that his right leg is a short leg. So I'm going to take my block, and this is all passive blocking. So I'm going to bend the knee and put this 45 degrees facing inferiorly under the trochanter on the short leg side. I'm going to go over to the long leg side, and I'm going to take the block and I'm going to angle it 45 degrees inferior at the level of the ASIS. And I would only block for a maximum period of time of 30 minutes. If his symptoms aren't changing, you can angle the blocks differently in 5-degree increments to try to reduce pain. Also, some of my indicators that I can check would be calf, hamstring, and glute, and that's Cat 3 blocking. Okay, so now we're moving on to blocking augmentation. As you can see, my patient is blocked in the category 3. So the first thing I'm going to do is the posterior iliofemoral technique. So what I'm going to do is I'm going to check the internal rotation of the feet. I'm going to take his feet in, okay, and look and see which one has less internal rotation, which in this case would be his right side. So then what I'm going to do is I'm going to go to that side and I'm going to palpate the ligament. So I'm going to go to the trochanter and I'm going to go an inch posterior and superior, and then I'm going to take a double thumb contact and I'm going to thrust towards the opposite side, obturator foramen, and then I'm going to recheck and check the internal rotation, and it should be more even now. Also, if need be, you can remove a block to perform this procedure. Okay, so then the next thing I'm going to do is the lumbar vertebral derotation. So in this instance, what I'm going to do is I have to utilize the Lovett Brothers system. So I go to the cervicals and I'm going to palpate the TVPs and see which one's more tender. And let's say in this case, it's his right C2 TVP, so that correlates to the L4 spinous process on the same side. So what I'm going to do is I'm going to take his right leg and I'm going to bend it back like this. I'm going to go to the L4 spinous process and I'm going to contact the right side with my thumb. And Boo, I'm going to have you inhale for me. And as he's inhaling, I'm pushing lateral to medial with my thumb on the spinous while simultaneously pushing the leg towards the glute. Okay, and I'm going to do this for a period of 5 seconds. And I will repeat this 3 times for that procedure. And then we're going to move on to lumbar. Okay, so now I'm moving on to the lumbar inverted lift. Also, I should clarify that whenever performing any sort of block augmentation for category 3, the patient should be tractioning the head of the table. So I'm going to have you do that now for me, Boo. Okay, perfect. So with the lumbar inferiority lift, it's kind of similar to the deep rotation. What you're going to do is do the Lovett Brothers. And in this case, you're going to come to the cervical spinuses. You're going to palpate which one's more tender. So let's just say in this case, it's C3 spinous, which correlates to L3 TVP and mammillary process. So you're going to take the patient's involved side, which we'll say it was C3 on the right, so it would be L3 on the right as well. And we're going to go to L3 out to the mammillary process. And what I'm going to do is I'm going to have you inhale for me. And I'm going to, while he's inhaling, I'm going to be pushing I to S on the mammillary process with my thumb, while simultaneously pushing his heel towards his glute. And exhale and release. And we're going to do this 5 seconds on and off for a total of 3 times. Okay, so then the next technique would be acetabular goading. So what I'm going to do is I'm going to goad both sides, and I'm going to see which one's the most tender. So, and then I'm going to, let's say it's this side in this case. So I'm going to go to the acetabular area, the trochanter. I'm going to take his knee, I'm going to bend it about this much, and I'm going to internally rotate and goad, and then, or I'm sorry, externally rotate and then internally rotate like this. Or you can even do circles if you like, and then break up those adhesions. And then the next thing is orthopedic blocking. So let's say in this case, he had a lumbar spinous process, we'll say it's L4 in this case, that was rotated to his right side. What I can do in that case in time is take out the block on that side, and then that's lowering the pelvis, and therefore it's going to help that spinous that's rotated over here rotate back to center, and then put the block back in place. Okay, and then last technique, we're going to do sciatic tractioning. So my patient's grabbing the head of the table. We're going to take the involved side leg, which will say he has sciatica on his right side. And what I'm going to do is I'm going to grab his leg above the ankle, and I'm going to traction back. I'm going to ease into it and hold, and then slowly release. I'm going to do this probably about 3 or 4 times slowly until they start to get relief. And then there's also assisted sciatic traction. In that case, the patient's not responding as they should be, so I'd have a CA or a helper come in, and they would traction the leg just as I did before. And I'm going to go to the involved lumbar area, correlate it with the Lovett Brothers system, and I'm going to come in with my thumbs. Let's say it's the L4 spinous. I'm going to push I to S, and like that, while they're tractioning the leg, and in order to reduce symptoms. And that would conclude block augmentation. Okay, so now we're moving on to post-block techniques. Also, I should mention, while the patient is blocked in category 3, after block augmentation, you want to do sacral base while still on the blocks. But I already did that. That's in my Cat 1 video. And then after that, you're going to remove the blocks, and then you perform sacral cupping, which I performed in my Cat 2 video, so you can reference those. Okay, so now they're off the blocks completely, and we're moving on to sitting disc. So my patient's going to be seated like this. We're going to have you put your hands on your knees, and then I'm going to be sitting behind the patient. And what I'm going to have you do, Vu, is I'm going to have you tuck your chin to your chest. Okay, and we're going to have him do a few practice moves first. And as a doctor, what I'm going to do is I'm going to go to the spinous of the involved level. And I'm going to contact it with double thumbs. Maybe we're just going to practice, Vu. So what I'm going to have you do is I'm going to have you inhale and bend your spine forward like that, okay? And then I'm going to have you exhale and reach my back. Okay, perfect. And so now we're going to have you do the same thing, okay? And go ahead and inhale and bend forward, okay? And what I'm going to be doing while he's doing that is pushing I to S on the spinous, okay? And extend back and exhale. And then I'm going to push P to A. And we're going to do this about 3 or 4 times until they start to get relief, okay? And then we're going to go ahead and move on to side posture. So Vu, what I'm going to have you do is go ahead and lay on your right side for me, left side up. And this side posture is specifically for sciatica. So there's certain rules involved with this. So the sciatic leg must be down. And if it's a rotation, the spinous should be rotated down towards the sciatic leg. And for the wedge, the TVP should be, or mammillary process should be up. Vu, I'm going to have you come a little bit closer to the edge. And so this is a little bit of a modified side posture. Okay, so what I'm going to do is I'm going to come like this, and I'm going to put my knee about the level of their popliteal fossa, like that, and then I'm going to come to the involved segment. There's no rotation, so I'm going to contact the mammillary process with piezoform. And for rotation, my line of drive is going to be straight P to A. And for if it's a wedge, my line of drive is going to be I to S. And that completes category 3.